And welcome to this edition of ACAP Today for the week of June 15th, 2020. I'm Jason Parent with the Aroostook County Action Program. It's a pleasure to welcome you all to our program today. On today's program, our guests will be from the state of Maine. First, the Maine Community Action Association, formerly Maine Community Action Association, now Maine Community Action Partnership. We'll be joined by Megan Hannan, who is the Executive Director of ACAP. We'll also be joined by two folks from the State Community Services Block Grant Office, Christa Elwell and Jaimi Clifford will join us in just a little bit. But before we bring our guests onto the program, as we always do, we want to bring you news and information that you can use, information valuable to our community in terms of how we might be able to assist you as this pandemic continues and the social distancing continues here in Aroostook County and elsewhere. So we'll start first this week with information that we wanted to share with you as a leadership team here from the Aroostook County Action Program. With all that's happening with both the pandemic and the equity challenges that we're facing across the country in the wake of what has happened in Minneapolis and elsewhere around the country, we just wanted to remind our community that we are in fact here for you and we're here for all people. And so this is the Community Action Pledge that the National Community Action Partnership uses as their guidelines and we use as ours. And so it says community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community and we are dedicated to helping people help themselves and each other. And all of us here at ACAP certainly live by these words. So please do be assured as our community out there that we do indeed serve all individuals and are here for you through these challenging times. And so with that, we move on to share with you that our offices do remain closed, but we are continuing to serve you at a distance. Please do stay in touch with us because we are looking at phase 3 reopening and are developing those plans now and should have more information to release to you next week at this time in terms of limited opening of our offices. We do and have added to that effect curbside assistance here at our 771 Main Street location in Presque. We are inviting folks who come to our office who need to drop off paperwork or have papers photocopied or need to connect with us in another way, that they can simply remain in their vehicles, call the main office, and we will dispatch someone to your vehicle to provide you with assistance. We are also celebrating this last week the opening of our childcare centers in Caribou, Colton, and Presque. This is a shot from our Holton Early Care and Education Center on Military Street in Holton, and the children are practicing social distancing using pool noodles to help them achieve that. We wanted to also share with you an update of our community impact. I believe the last time that we shared this information through this venue with you, we had served just over 600 new clients. Our new tally as of June 1st indicates that we have over 1,000 individuals, new individuals and households that we have served since the pandemic first began to impact Aroostook County, at least economically, in the middle of March. And you can see here some of the many ways in which we've served Aroostook County households. Of note are the over 50,000 meals that have been delivered to families across Aroostook County. And we continue to assist folks with the Home Energy Assistance Program. We're actually reaching out to folks at this time who maybe were not eligible last season, who might be eligible this season, in hopes of getting folks set for the coming heating season, even though we're heading into the summer at this point, so that they're all set for next fall. So we certainly encourage you to reach out to us for any of the programs that you're seeing here on your screen, or just if you need any assistance at all, we certainly will do our best to serve you in any way that we can. The next piece of information we wanted to share with you is that as it relates to healthcare navigation. We know that a number of people who have been impacted, their jobs have been impacted as a result of the pandemic. Our healthcare navigator is standing by to help folks that may need assistance and learning more about their healthcare options at this time. Please call our main office at 764-3721 and we will schedule time for our healthcare navigator to speak with you. We are also continuing with the COVID-19 rent relief program that provides participants up to $500 that goes to their landlord for their rent if they have had their household impacted economically by COVID-19. You can get an application on mainehousing.org//COVID rent, or call us and we will help you complete one online. We have helped over 450 Aroostook County households, and that program has been extended into June. It is important to note, though, if you were helped in April or May with your rent, you're not eligible for June, and we will be announcing details of a new program that will start later this summer when we have the information finalized on that. I did mention the healthcare navigation, marketplace navigation. In addition to that, we are doing general navigation services for individuals who are just unsure of where to turn at this point for assistance. Many people are experiencing financial hardship for the first time, and so we certainly encourage you to reach out to us for that, in addition to the healthcare and marketplace navigation services that we are offering. The Home Energy Assistance Program continues through July 15th for this season. If you have not had a Home Energy Assistance appointment since September of last year, certainly please do call us. There are special accommodations for those who have been impacted by COVID-19 in terms of the look back on income. But we also certainly encourage you to look on our website where you can find the latest income eligibility guidelines, and they have changed from the previous season, so more county folks are eligible for this program, and we certainly encourage you to take advantage of that now while appointments are easily and readily available in terms of scheduling. The Head Start program is accepting applications for fall of 2020. All of that can be done over the phone and through use of technology such as this. So please do consider giving our program a call at 768-3045. We are taking slots in programs in Fort Kent, Caribou, Presque, and Colton. But if you don't live close to one of those centers, please do call us anyway. We have some Head Start home visiting slots that are available and can talk to you about transportation options to get children to centers. Workforce Development here at ACAP is offering a new series of workforce workshops beginning on the 25th of June with career decision making. On the 2nd of July, they'll be doing a job search workshop. On the 9th of July, resume writing, and on the 16th, interviewing tips. Workshops are all held online through Zoom and all at 1 p.m. in the afternoon. Please contact Kathy Williams using the information on your screen if you would like to register or for more information. We also are offering tobacco cessation programs at this time, as we regularly do. Elaine Sipe, our tobacco cessation individual, is ready and available to help you, and she can do that work also via Zoom or over the phone or in other ways. So please do contact Elaine, again, at the information on your screen. If you would like to quit smoking at this time, that service is certainly available to you at a distance as well. We also wanted to let folks know about the new pandemic EBT program that is available for families to receive up to $363 per child to spend on groceries, in addition to meals that the schools are providing. I do know that a number of the schools in our community are taking a slight break from the regular school program delivery to summer, so there will be a gap there for some families, and this is a wonderful program to be able to take advantage to help families through that gap. Please do reach out to the information on your screen there before June 30th to apply. We certainly encourage folks who are eligible, and the eligibility requirements are that a family receiving SNAP or TANF, they don't need to apply. This should be automatically this benefit should be automatically coming to you. However, if you do receive free or reduced meals at school lunch, you can apply for this and you will get your PEBT card coming to you in the mail. So please do contact the number on your screen here if you have any other questions related to that program, and call us, we can help you as well. And lastly, today in the news and information you can use, we have launched our community needs assessment. Over 600 households have already responded to the community needs assessment. It's still open for a number of weeks. But we do encourage folks to please reply to that. There is each week that the community assessment is available, we are running a contest, and we award a $100 gift card as a result of a random drawing for folks who do respond to it. We really do want to hear what our community has to say. And one of the reasons why we do is because of the guests that we have on our program, and we're going to talk about that with them in just a moment. But if you would like to reply to our community needs assessment and tell us what you feel your community needs, please do the Survey Monkey, and you can connect via our Facebook page or also online on our website. And with that, that's today's news and information that you can use from the Aroostook County Action Program. I'm so pleased to welcome to the program today, again, as I said, Megan Hannan, who's the Executive Director of the Maine Community Action Partnership. Megan, welcome.
Thank you. It's nice to be here.
And joining Megan on the broadcast today from the state CSBG office, Christa Elwell, who's the Business Services Manager for the Office of Child and Family Services. Christa, welcome. Oh, great. We have you on mute, actually, so we'll there we go.
Thank you so much.
It's nice to see you. I take it the power has come back on.
No, I found a place to plug in via the generator. So.
Wonderful. So there was a power outage, or there is a power outage at Christa's working from home residence at the moment. So we're thanking her for doing extra duty and getting online regardless of that challenge. So thank you, Christa. And lastly, of course, Jaimi Clifford, who is the state CSBG coordinator. Jaimi, welcome.
Hi, thank you for having me.
Great. So Megan, we're going to start with you because Maine Community Action Partnership is a relatively new name, not a new organization by any means. So tell us about what Maine Community Action Partnership is. And I'm seeing here on the screen, we have both MECAP and we have Maine Community Action Association. So sorry about the, we're still getting used to the nomenclature and the change. So tell me about MECAP.
Well, I'm actually pretty new to MECAP too. I started in January, and so I've just been so excited, even though my first 6 months did not turn out kind of the way anyone expected them to, I don't think. It's been a great time to learn so much about what the community action agencies do and how much they touch every part of people's lives throughout the state. You know, whether we just went through them, whether it's heat or health insurance or with kiddos at preschool, pre-K, and Head Start. It's just a wonderful thing. So what we do really is try to pull everybody together. When we have opportunities to get grants where we can do one grant to take care of the entire state, we'll try to do that. If we have opportunities to do community outreach, we'll do that. If we have opportunities to do things like right now, we are working with the Department of Health and Human Services to provide social services for people who are either have COVID or have been near someone with COVID and has to quarantine or isolate for a period of time. We're going to make sure that they can do that for the 14 days so that they can keep themselves and their communities and families safe.
It's great. I know we're looking at a graphic here that kind of shows, and I love looking at this graphic just, you know, selfishly because we're that one little lone dot at the top, and there's a lot of real estate between us and the next community action agency there, which you can all attest to because all of you have driven up here at one point or another into Aroostook County and visited with us. Christa came and did a great review of our programs, gosh, a little over a year ago now, or under a year ago, but it seems like over a year ago. So Megan, tell me about the Community Action Agency and the network and how it's coming together. You shared about these new programs that are happening and the opportunity to apply for grants, but there is quite a breadth of programs and services when you put us all together.
Yes, well, I think we all work together on things like energy and housing. We have the leads of each of the organizations throughout the state that meet regularly. We do that with several others. We help the Head Start directors meet together, even though not everybody has Head Start. Most of the CAPs do have Head Start. We do that with our staff who are in charge of the CSBG funds that you're going to hear more about in a minute. So we like to be able to learn from each other, to be able to help each other through little snags. We can be more powerful when we're together. Another piece of my job is advocacy. So at the State House, making sure that policies that are passed or not passed, depending on it, are things that are good for people in our state.
Megan, one of the things that we've been talking about in the last couple of weeks, not only in the last couple of weeks, but they've been very pronounced in the last couple of weeks, is what's happening around the country, both as it relates to the pandemic and sort of the disadvantaged communities being especially impacted by the pandemic, and then more recently what's happened in Minneapolis and the challenges there. And we just had up on the screen the MECAP Black Lives Matter Huggy Heart logo, which is part of our national association, the Community Action Partnership. So talk to me about the conversations that have been happening around racial equity and the challenges we're facing as a country and as communities.
Yes, well, these are important things that certainly didn't start with the pandemic, but have been made really clear through the pandemic. It's hitting at a time where we are having a healthcare crisis, we're having an economic crisis, and clearly we're having a social problem, a social crisis at the same time. Even in Maine, in fact, I heard this morning Maine has one of the highest, I think is the right word, number of disproportional people of color who are getting sick compared to the number of people of color we have as a total population. People of color have many health disparities, and there are a lot of reasons for that, but poverty is definitely one of them. People don't have access to health care for the prevention that they need. They may be of lower income, and so they don't have access to fresh fruits and vegetables. It's much cheaper and easier to fill up your bellies with pasta and some prepared foods than it is to be able to have access to fresh fruits and vegetables and make your own meals. It's also hard sometimes when people have 2 and 3 jobs. And then if they have children as well, trying to get everybody in the same place doing the same thing. So we've been talking a lot about this at the local, as in Maine, and at the national level. Our national office came out with a very strong statement about the promise that Jason started with. And when we say all people, we mean all people. We know that we are serving all people and that Black lives matter and brown lives matter and poor lives matter. And so we have been very consistent in that message, but also taking advantage of this time to even be more so and talk about it more openly and freely than we might always have the opportunity to do.
This has always been at the root of community action. I mean, community action was born in the civil rights era. Dr. Martin Luther King, Lyndon Johnson, in that time frame, and this is really at the heart. When we talk about the Huggy Heart as the logo, this is really at the heart of community action, isn't it, Megan?
It is. It absolutely is. And you know, May was Community Action Month, and so we had a lot of things in our social media, and we had quotes from both of them about community action and the importance of community action as part of the struggle for equal rights.
And so that's a good pivot point, because when we talk about community action, we talk about the community action movement and its roots and its origin. It didn't start as a block grant program, but it's a block grant program today. And we talk about we've been using and we toss out the letters, and we notice we catch ourselves doing it here with new board members and the like, Csbg, and a lot of folks get it, they think of CDBG, which I think a lot more people are aware of. So let's demystify what CSBG is and Community Services Block Grant is, and why it's so integral to the community action movement and the work that we do. And so we're going to invite into the conversation now Jaimi, Clifford, and Christa Elwell. And I'll start with you, Jaimi, in terms of helping people understand when we use this acronym CSBG, what we're really talking about.
Sure, thank you. So CSBG stands for the Community Services Block Grant. And so the community services are essentially community action. This was a direct result of the war on poverty from the 60s. And it's the only federal grant in which the grantees, which are community action agencies, are responsible for researching and listening to their community and finding out where the needs are and what are the gaps in services that are out there, and using those results and list from not only just collecting data, but actually listening to the voice of their low-income members, and then using the funds from this grant to dictate how they're going to meet the needs of those individuals. And so, the goals that we have listed are very simple words, but to reduce poverty and revitalize your low-income communities. But really, I think, as you know, at ACAP, and likely your community members know, that ACAP is so much more than just reducing the poverty levels and revitalizing their communities. The work that you're doing and the partners that you grow with these funds are substantial to to your community as a whole. So, the Community Services Block Grant to the state of Maine is a very small amount of money, but it does a whole lot of work.
Now, Christa, you had the opportunity the last time ACAP had an on-site review for the work that we do both around the Community Services Block Grant and as a CAP agency in general. You sent us back some feedback on that. How do you see both ACAP and other community action agencies across the state of Maine responding to what Jaime just detailed about the goals of the Community Services Block Grant?
Yeah, I really see ACAP and the other community action agencies around the state and within the community is really sort of the one-stop shop and the first place for people to go if they have a need. So if someone has that need, whether it's a family, an individual, whether it's someone who's like of my parents' age or anyone has a need, it's really what I think of as the first place to call and making the connection to whatever services could be needed really by anyone in that community. And if it's not something that ACAP or the other CAPs provide themselves, your agency as well as the other CAP agencies know of all the other resources and are well positioned, and through all the collaborative relationships that you've built are able to put folks and make that connection to those other items that may be needed. And I really see that as, I know kind of like one-stop shop sounds, it's like that cliche term, but it really is, it's so true. And I think community action agencies really are sort of that hub and really kind of center those communities. They're just so, I don't think I can begin to describe really the importance, and having gone around the state and gone to each of the agencies as well as ACAP and done the reviews and learned so much about the critical work that your agency is doing within your community and just how vital it is. It's just so important, the great work that you guys are doing. I really can't emphasize it enough. I continue to say, the more that I learn about the Community Services Block Grant and the work that you do, it really is sort of brilliant of how they set it up years ago and sort of how it's grown to really serve sort of as a tool, a mechanism to really help folks and members of the community become self-sufficient. And you and your staff are so critical in that. It's just so important in a community. Sort of maybe the anchor is the best way to describe it. That the CAP agencies, I see them as really sort of anchoring and supporting their communities with the critical services that are being provided, particularly at such a at a time such as now with everything that we have going on. And it's really so critical in the history of service provision that you have within your community.
Great. Thank you, Christa. I know, Jaime, you sent along some information that you wanted to speak to as well, and one of those points I think ties right off from what Christa was saying. It's really more than service provision. It's also about engaging the community. So it's about, we talk about hearing the voices. We talked about the community assessment that we're working on right now, which is something that CAP agencies do every 3 years. But it goes beyond just assessing folks every 3 years for their needs. It's a constant connection and giving a voice to people, to go back to what Megan was talking about, individuals who don't always easily have a voice in discussion about what they need and how they can best be served.
Yeah, you're right. And, it does even come down to, as I'm aware, the community action agencies have a formula for their boards even that are required. And that requirement brings the low-income voice to your board every meeting, and not just during a community needs assessment. And there's not many boards that are structured that way, where you're including the voice of all individuals, especially the ones that you're serving, and the partners that you're bringing to the table that you work with to create these gaps in services. ACAP really becomes and other agencies across the state and the nation really become that hub, as Christa was saying, as you're maximizing participation of your low-income community. So it's not just your senior management team making decisions, right? You're listening to individuals that are actually impacted month to month as you make decisions about your programs. Some of the role of community action and CSBG is leveraging those resources of other anti-poverty programs, but not even just anti-poverty. You're talking about connecting with your local hospitals to make referrals easier and or access to services easier, solutions in your communities that as needs. You know, I remember there being a time where the hospital was doing laundry for some of the homeless shelters because they didn't have the capacity to do that. And that's just an amazing partnership in a community of helping, you know, meet those needs. And CSBG is really not just all of that, but strengthening your community as a whole, and having that foundation at community action is so important.
When we look specifically, because both of you, Christa and Jaime, have both visited here and have both review the documents that we send you, you know the work that we do. How is the Community Services Block Grant living and breathing here in Aroostook County?
I think that Aroostook County is really paving the way for a concept called whole family approach. And so really whole family is meeting the needs of the entire nucleus of a family, rather than just the individual that's coming in for assistance. You know, you're asking that individual furthering questions beyond what they've called you about to ensure that we're kind of really solving a whole need rather than just a fraction of it until there's a new need. And so CSBG partakes into your agency in many different ways rather than just one. But also, you know, ACAP has used their CSBG to tackle homelessness in your county. And that's not just providing an answer, but also as we've entered into this pandemic, you've become innovative and worked with partners, again, through the University of Maine and Maine Housing to make sure that those services are continuing while we're in a time where we can't be in close-knit quarters. And also that you're not just meeting the need of homelessness, you're providing a place to go during the day, which I just think is integral to the problem that exists of homelessness. It's not just, you know, needing a place to stay at night. Workforce development, you mentioned it earlier, but you're providing education and training and employment services to all types of individuals, which is going to be a huge factor going forward in our economy here in Maine and across the country, is being able to provide training to the individuals who are experiencing job loss and maybe having to enter into a new type of job that they've never had training from before because it's available income. But also, I think most importantly, we've talked about this quite a few times, is building the partnerships with other providers across Aroostook County. ACAP has done a great job of pulling together work groups to expand their resources and provide greater service delivery. And it just really speaks to the innovative solutions that come when tackling the persistence problem of poverty.
How do the three of you, let me ask this question of the three of you, how do the three of you see, knowing what we know now, things changing? I mean, I'll just give you a little preview. Sherry did some of the data mining of the initial 600 plus surveys that we've received in our community assessment, and we've already seen anxiety and depression supersede hypertension as a community health concern, which was vastly different in our last community needs assessment. So responding to that and where you see things headed, we have the CARES Act funding that we haven't spoken about yet. It's related to CSBG. Christa, let's start with you. Where do you see things headed for community action as a result of what we're experiencing now and the effect that will continue for the months and years to come?
Well, certainly I think one of the most exciting things, you know, a positive in terms of, I always try to look at and see what the positive is in things. And, you know, COVID-19, there's been so much with that's concerning. A positive of that is sort of the attention that is, I think, being placed upon CSBG, as well as, and due to that on the work that community action agencies do. So in my opinion, on the national level, both in Washington, D.C., there's much more interest, much greater interest in the Community Services Block Grant and community action and the work that you folks are doing at ACAP and all the agencies around the country. So I think that is extremely important, and I think that may set a stage for us going forward. We've seen with the COVID, the additional $5.1 million that Maine is in the process of receiving. We'll be receiving that hopefully very soon. And then they'll be looking at the allocations for the federal fiscal year for 21. And, I know they're hoping that there'll be an increase in that. So I think on a national level, it has highlighted the so important work that community action agencies are doing every day. And I think also seeing the impact that CAP agencies can have sort of like in a pandemic, like what's going on now, and how critical it is, since really the infrastructure for doing a lot of that work is there because of the work that ACAP and community action agencies around the country. You guys are very well poised to sort of, you're already well in communities and established, and, have those collaborative relationships that you've built for years. So I really think the future looks, I think, really great for the work that you guys are doing. I dare not speculate too much, but I do think it's been, been really positive that it does highlight. And again, I think particularly in Maine, we're well positioned because of the work that community action, that your agencies are doing on a daily basis, to be able to get out in communities and ensure, in terms of the funding that we'll receive through Csbg for COVID, to ensure that's going to get, out there where it's needed and be maximized to, the full potential.
Thank you, Christa. Appreciate that. Jaime, your thoughts about where things are headed with community action?
Well, I think we all can assume that there are more people that are in need than we're used to people being in need. There's individuals that maybe have never been affected by losing their job or reduced income, or even just the fact of their kids being home and the rising costs and groceries as we go through this crisis. So I do see that the history of community action really puts us on a platform of being the right knight, if you will, to fight, the battle on the baseline, right? But I think that you also will be so that community action is so well versed in meeting needs of individuals who are in crisis, that as we see more and more coming in, you're already ready to do that work. And so we've already seen that there's a little bit of relax in the eligibility guidelines of who then can be eligible to receive assistance. And that is monumental, because that has just been such a strict and also a very low line to be at, right? In regards to, especially where Maine is sitting, that to see that it's already been moving forward with allowing more individuals to be served is a great sign as to, I think, our government understanding that more, just your income level isn't a good indication of what defines you of needing assistance. And so I hope that trend continues.
Great. And Megan, Hannan, your thoughts on your crystal ball for community action?
I don't know about that. I agree with everything that Christa and Jaime said. And when Christa was talking about Congress, I was on a national call yesterday. I think, Jaime, you were on it too. And they are talking about, wow, these CAPs do this, they do this, maybe they could do this and do this. And some of those things were really community building. And to your point about people feeling stressed and feeling anxious and feeling depressed, we have an opportunity to not go back to where we were in February, but to instead think about what we want February of 2022 to look like, and do things differently, create systems differently. You know, schools and restaurants and things are going to be different. So how do we make sure that different is better and not just different? And that people don't just miss being able to sit next to each other or get annoyed by having noodles between them in the classroom, and say, we can actually use this as a way to better do X, Y, and Z. I don't know what those things are, but I think the opportunity to do some community building is a good one. And I think it's a role that is perfect for the CAAs to take on. And I look forward to figuring out the best way to do that in Maine, so that we build a better Maine and not go back to the same Maine.
Great for each of you, and I'll start with you, Megan, since the camera was right on you there. Anything that we haven't talked about that you wanted to make sure folks know about, and your advice for folks as we transition into soon phase 3 and get through the rest of this pandemic and sort of deal with the remaining vestiges of social isolation and all of those things. So last thoughts and any advice for folks.
I can't think of any quick last thoughts, but certainly on the advice side, I know that unfortunately the pandemic has become a political flashpoint, and it's unfortunate. So I think the most important thing is to know your own risk, know your age, your pre-existing conditions, where you are and what you need to do, and wear a mask. Stay 6 feet apart from people, unless they're the people that you live with and have already been in the germ pool. And to just be careful and be courteous. Don't assume that other people have the worst things in mind, but assume that everyone is trying to get through this together, and that we will. And, unfortunately, we're in the time of Earth where we're going to be getting new germs and new bugs, new things again and again. We've seen it for the last several years, 10 years. So this isn't the first, and it's not going to be the last. So let's be careful. Take care of yourselves and the people you love in your community, and we'll be fine.
Thank you, Megan. Jaime, Clifford, your last thoughts and advice for folks.
It's a hard one to follow, but I think Megan is right there, is that anxiety and depression are a real response to this, and that you're not alone in that. But also, it has become very political, but to just be mindful, be kind, stay safe, and as much as you can, right? I think there's a real challenge between deciding when it's appropriate to go out and into public or not, but we all have needs, and so to do it mindfully and as safe as you can, because we do need to we're still human. Interaction means a lot, and so do it to the best ability that you can without putting yourself at risk.
Thank you, Jaime. And Christa, the last word is yours. Anything else you want to add, and your advice?
I certainly echo what Megan and Jaime said, and add, if folks have needs, the Maine 211, and reach out to ACAP, or if you're in a different area, another community action agency that serves your area.
Thank you very much. And that actually is a perfect segue, Christa. And I want to make sure I thank first Jaime, Christa, and Megan for joining us on ACAP today. And to follow right along with Christa's great advice there, we want to do want to encourage you to reach out to us if we can be of any assistance at all. And maybe we won't be able to be of assistance on the immediate thing that you're calling about, but we can connect you with those services. So do call us at 764-3721. Connect with us at acap-info@acap-me.org. You can find us on Facebook. We put out lots of great information there. You can also look for our YouTube channel, where we have some past programs of ACAP Today, but also some wonderful early childhood education lessons, some community prevention team lessons out there, and some wonderful story time opportunities for kids of all ages to enjoy across Aroostook County. And please do also check out our website at acap-me.org. And as we do each time on ACAP Today, we usually end with a snapshot snapshot of the week, but we have some snapshots of the week. These are children enjoying themselves outside of our Caribou and Presque early care and education centers, having fun in the sun as they reopened and were welcomed back by their teachers who they missed greatly and who they were missed greatly by their teachers. Thankfully, we had some great weather this week, so the children could spend a lot of time outdoors, and that is our goal, to help keep them healthy and safe. And we welcome them back, I'd say with open arms, but we're trying to avoid contact at this time, but we certainly welcome children and their families who have returned the children to our early care and education centers for our childcare programs. We will be doing summer Head Start programs remotely, including some driveway lessons, and families in our Head Start program will have more information and instruction about that coming up soon. But thank you to these cute kids for allowing us to take their picture and for having a great time in the sun. And thank you to all of you for joining us on this edition of ACAP Today. We'll be back next week with another edition of the program. Please do stay healthy, and stay safe. Have a great week, everyone.